Hi, everyone. Let me just start off by apologizing for my voice a little bit. I've got a little bit of a cold, but welcome to Toni Time, where solutions are just a discussion away. Now, today we're going to lean back into this topic of limiting visitors and raising up care partners and support persons and connecting that to our new CMS patient safety structural measure that is effective January 2025. I'm Toni Land, founder and chief experience officer for Landing Exceptional Experiences and your host of Toni Time. Now, if you remember on our previous videos, and I will make sure the link is in the description, on our previous videos, we talked about workplace violence and 72% of that workplace violence being verbal, while only 28% of it is physical. And many organizations have policies in place and have put things in place in order to mitigate some of that physical abuse and violence that takes place in the healthcare system. Although we know it's not perfect and things still happen, unfortunately, but we have not seen as much work done around the 72% of verbal abuse or verbal violence that takes place in the organization. So when I asked leaders recently, and I was on LinkedIn and I put a poll out and asked leaders recently, do you have a formal policy for verbal abuse? Very, very low response rate. But of those who responded, over 95% said, yes, they do. Now, I did have several nurses reach out to me through message, and then I talked to some personally by phone who also said, yes, they had a policy, but they had a hard time really answering yes to that because the policy was hard to enforce, which is probably some of the reason why we still see such a high level of verbal violence and verbal abuse in the healthcare system. Now, I will tell you that oftentimes this lashing out or verbal abuse is from a family member or a visitor. And so as we talked last time, and we'll talk a little bit this time, that's different from a care partner or a support person. And so some of that underlying cause could be fear, uncertainty. They're feeling this lack of knowledge and this lack of control and lashing out as a result. So what do we do about that? I think one of the things we can really start thinking about is, how do we shift the perspective here and communicate differently? So the new CMS patient safety structure measure is focused on creating this culture of safety that starts with C-suite and board members, and then of course engages the whole organization, but really taking that approach that those who are responsible and who have fiduciary responsibility for the organization must embrace a culture of safety. We follow the leader, and so we need the leaders to embrace that culture of safety. So there's several domains it's an attestation measure, and there are 5 domains that you have to attest to, and there's statements under each domain that you have to be able to say yes to in order to get a point for that domain, and 5 points are the maximum amount of points that you can get. But we are going to focus today on the patient and family engagement domain. Yes, they have a whole domain that is specifically on patient and family engagement, and it is domain 5. It gives you in general what this specific domain is about. It's about effective and equitable engagement of patients, families, and caregivers, and that is essential to safer, better care. And so hospitals must embed patients, families, and caregivers as co-producers of safety and health through meaningful involvement in safety activities and quality improvement and oversight. So what does that really mean for the organization? These are the 5 statements that are under domain 5, that the organization has to be able to say yes to these things in order to receive 1 point for this domain. Your mind might immediately go to, well, Toni, how can we talk about decreasing visitors? I think we have an opportunity to change that conversation to what is a visitor versus what is a patient and family that's engaged as part of the care team, as part of that support person. And that, I think, is where our difference comes in. So first of all, you need a PFAC. If you don't have a PFAC in some shape, form, or fashion, they aren't defining specifically what a PFAC looks like for, this is a hospital measure. So what it looks like for your hospital, that might look different. Be creative, open up, and allow different modes of engagement so that you can have the right representation at your meetings. And one of the measures before this also talks about education and education for C-suite board members, and that would also be for your patient and family advisory council. And so you want to have an active advisory council that includes representation on your board meetings. They're consulted, not about, yes, I won't say they're consulted in addition to some of the things that we've consulted them about before, marketing materials, as we're on a building project. They're also saying take that next level and engage them in safety and goal setting metrics and participation in safety improvement initiatives. You want it to be a diverse group of people and representative of your patient population. And that definitely takes some intentionality, really looking at what is the population that we serve as an organization, and even narrowing that down. What is the population that we serve in this specific community, if you're one of the community hospitals, and then truly being intentional. I can tell you in my past, we've done some of these PFAC council meetings at different times so that we could meet the need of working moms. We had some working moms who wanted to participate, but could not meet at 1 o'clock or 3 o'clock in the afternoon. So we were creative and flexible around that. We've had times where we've offered a virtual option and a phone option even for people to be able to participate. We even had a time where we had a gentleman who really wanted to be engaged in helping our organization be the absolute best. And so every month we would go out and pick him up and bring him to the meetings. He wanted to come in person, and that was our way of really making sure that he was able to participate and that his voice was heard. Now you can see here, it talks about access to their own records. They're encouraged to get in there and see their own records and have a way of being able to submit for comments. And then on D here, you see that we're incorporating that patient and caregiver input into safety events and issues. Where I really want to focus in is on E, that our hospital supports the presence of family and other designated persons as defined by the patient as essential members of a safe care team, and encourages engagement in activities such as bedside rounding, shift reporting, discharge planning, and visitation 24 hours a day as feasible. So what you don't see here is that it says our hospital supports the presence of visitors. It says a family or other designated persons, the patient is to define that can be a part of the safe care team. And we talked about this in the previous video also. So then I think this helps us to step back and to be able to say, do we really need to have open for any visitor, my next door neighbor, anyone to be able to come, versus saying and communicating effectively? One of the ways we provide you safe, high quality, respectful care is really looking at who is your core team, who is your support person or support persons that know you, are able to be with you in the hospital throughout this journey, and able to help you once you go home. Because here we're talking about that second set of ears in the room, so that you're able to, now when you're having a shift report and you're including the patient in some of that who is highly stressed, and not hearing everything that you're saying, that you have a second set of ears there who's also hearing that, being able to help their loved one on this journey to being able to get out of the hospital. They're part of discharge planning. And if we step up and think about the violence that we were talking about, they are also then able to communicate effectively. Because one of the things we would want to say then, as they are coming into the organization, we would want to communicate, what does effective communication look like? What are the expectations around that for them as the designated caregiver or support person, and what they can expect from you as a team member. So statement E here under Domain 5 really gives us an opportunity to start embracing, encouraging this role of that designated caregiver and support person more, elevating that more than a visitor. You really want to communicate to them that this is the person to help on the health journey. Communicate with the healthcare team, share that information back with the family, and also be a part of them going home. We will want to encourage that designated person or persons to be there 24 hours a day. So they could trade off if they designate more than one person, in order for someone to always be there at the bedside of this patient and family member. So, I mean, that communication is so important. And I'm going to stop sharing my screen here. So it's an opportunity here really to narrow down the number of people that we're communicating with. So yes, the patient themselves, if they are able, but then the designated person, I'll use myself. Then if, for God forbid, my mother-in-law were to be hospitalized, then it might be me and my husband and maybe my brother-in-law. And so the three of us might be those designated people that then we would trade off, and one of us would be at the bedside at all times. Now, the team could communicate with us then. They could have videos, they could have written information, and verbally share it as many modes as possible. We learn in different ways, but share with us, hey, here's what you can expect during your mom's hospitalization. I read a Reddit post recently where some ICU nurses were very frustrated because they would go on break and a family member might call and then be frustrated that nobody's looking at my mom. They shouldn't be able to go on break. Well, we know that everyone needs a break. That nurse is going to come back much more refreshed, that tech much more refreshed if they have that 30-minute break away to truly be able to clear their minds, replenish their bodies and their spirits. But if we communicate on admission to this smaller core team, hey, on a daily basis, here's how you're going to get your update from us. If your hospital's doing bedside report at 7:00, we are going to be between the hours of 7 and 7:30. We will be coming in at the bedside, give them a quick snippet of what that looks like so they are prepared for that. And then you're going to talk about what shift handoff looks like. You can talk about when your nurse or your care team goes on break, then there's always another nurse or tech that is covering for that person while they're gone. And so here's what you can expect in those cases, that we come in and we'll let you know, hey, I'm going to be off the unit for the next 30 minutes. Toni will be your nurse, and Teresa will be your tech. So really just letting them know, communication, but then we're able to kind of change the dynamics here because we've got a core group of people now, people who are starting to know you, and you are also starting to know them. So part of that conversation is also, in order to effectively communicate with your care team, we've got something here where you can write down notes. You can write down questions that you might have. When I come in, feel free to ask me those questions while I'm in doing blood pressure or where I'm getting your mom bathed or to the bathroom. Feel free to ask us those questions. When the physician comes in, the doctor comes in, feel free to ask those questions. We want to make sure that you know what's going on with your mom, and we answer any questions as we are on this journey towards getting her home and helping her to be able to stay there. We even can bring in some of the age-friendly. There's another measure, January 2025, the age-friendly measure, in really finding out from the older population what's important, asking the mom, the actual patient, that if she's able to engage. If not, then you're going to ask this designated caregiver. Now, one of the questions somebody asked me just this week as I was talking with someone around this patient safety structural measure and the age-friendly measure was like, well, when do they designate this person? Now, in our ideal world, they would designate this person with their primary care physician. If you're a large healthcare organization or an organization that has medical practices and primary care physicians, clinicians engaged with your organization, then in the ideal world, that conversation would happen then. In the event that you're ever in the hospital, who would you want to designate as your support person or care person? When my father-in-law was going through his chemotherapy journey, we were at every appointment with him. And had that question been asked, we would have been that care person and that support person. But I want to back up just a second. I think we also have to define then, what is the role of this care, this support person, this designated family member? What's the role? Because many times we ask, who do you want for your primary contact? That may not be the person that you want to be your support person and caregiver. So I think really being able to define, if we're in that medical practice setting, then say one of the things our organization does in order to really provide you with the highest quality, safe care is really ask you to think about a support person or a designated primary caregiver person that would come alongside, that they are familiar with your health journey and that we can communicate with, and they can be alongside you on your health journey, oftentimes even that second set of ears, so that during any of our appointments, or if you're hospitalized, they could also be that person in that hospital space. So you see where that conversation can start early on, med practice, primary care. If you're being admitted and you come in, and registration can also ask that question. So it can be designated in your EHR, who is your primary support person, and your organization will have to decide what kind of language they want to use. This person would be considered a part of the patient safety or their safety care team. That's the role of this person. So that way it's in the HR. And then, the nurse or tech, when that patient's coming up, would be able to say, I see you have, 2 people designated as your, primary support person or caregiver. And then being able to say, hey, we need some time. Let's talk through your role here. And I'm going back to the hospital because the CMS measure is hospital specific. I want to go over your role here so you understand that. Let me go through, I have some papers here for you, but let me go through that also. And if you want to leave your phone number, this would be game changer. If you want to leave your number with us, we can put that in the system and we can text this information to you so that you have it on hand and understand what your role is and how to effectively communicate. In part of that conversation somewhere, I would also say part of keeping our patients and families safe is also ensuring that our own team members feel safe as they come in to serve others. And so there have been nationally a number of physical, violent activity happening in the health system. And you may have seen that out there as the media will often, report on those issues. But we have a high number of verbal abuse and lashing out that happens in the healthcare system. And so we just want to talk about how we make sure we effectively communicate so that we decrease frustration and we decrease anxiety and we decrease the amount of verbal violence that happens towards our own team members. And of course, vice versa. We would never want there to be verbal violence towards you either. So start having that conversation as you work through what does that look like and sound like and feel like in my words. Give them clear examples of how to communicate effectively. If they feel like something is not going the way that they would expect it to, then tell them how to show them how to communicate that. Maybe they feel like their mom has not been turned properly. Then ask them to press the call bell. And then when you come in, let's talk about how do we make sure that your mom is getting turned as frequently as she needs to. And remember, that's not going to be exactly on the hour. We may be just a little early, we may be just a little late, but know one thing, we have not forgotten about her. I may be in with another patient, but I'll be making my rounds to ensure that she gets turned because we definitely don't want her to get any type of, pressure ulcers. So being able to effectively communicate and letting them know that, if you feel like you're having challenges communicating with the team, then let us know so that we can figure out what is the barrier and what's the challenge, because ultimately we're in partnership together to help your mom have the best outcomes possible. So I think you'll find this domain, and I will put some links to this patient safety structural measure and actually the age-friendly measure also. Both are attestation measures that are effective January 2025. So I think I've talked through already, what do you do about some of this? Co-design. I say it all the time because I feel like it is so important for us to truly include the people who do the work in the design of the work. So include your clinicians, your nurses, your techs, your therapists, your unit secretaries, if you have unit secretaries. Include those folks in these conversations. Include patients and family members, as that domain talks about, and especially in E talks about, and actually in A talks about them being a part of safety goal setting metrics. Then this is a part of that design and that conversation, because I think some of those metrics, yes, they are things like length of stay and readmissions, impacting some of those measures, and health management as far as adherence, so that you see improvement in health management around diabetes and uncontrolled hypertension. But it's also a decrease in reported verbal violence that happens on the unit. And so your teams need to know that you recognize it's a challenge and you are open to exploring what do we do about it. So here again, I think it's an opportunity to limit visitors, like my next door neighbors, and really talk to patients around who's important to be in the room in order for us to go on a journey to the best outcomes possible. So we're going to focus more on this support person and care partner versus visitors. Start looking at what does the education look like? What does written education, verbal education, videos, all the multi-modes. If you have SMS ability, I'm a huge fan. Texting ability, what does that look like? How do you effectively communicate with the patients and families around, and your communities around this shift, and really start going out and even talking to communities about this change and why you're making this change and how it's important for the better outcomes for our patients and our families, and also for our own team members. So I'm looking forward It's a big change. I am looking forward to hearing your thoughts and your comments below. So let me know where your head is around this, decreasing visitors and increasing support persons and care partners. Now, let me tell you a little bit about Landing Exceptional Experiences. We partner with healthcare organizations to build a culture that delivers experiences that improve patient experience measures and also Leapfrog Hospital Safety Grades. I look forward to an opportunity to connect with you, talk about some of this work and some of these CMS measures that are effective in January 2025. You'll see a link below in order to schedule your free 30-minute consultation. Thank you for joining us today. Don't forget to like, subscribe, and share. This is Toni Time, where solutions are just a discussion away.